Hi everyone, it's me, Melanie, your IVF nurse, and today I'm going to be doing a video on a newer pen called Rekovelle. Now this is something relatively new, so you may not see a lot of videos out there about it, but if you're using the Rekovelle pen, the drug company, which is Ferring, does have a video that you can access through their website. So it goes through everything, but I'm just going to do a quick video to show you how it's done. Now, with your Rekovelle pen, it's going to come in a box that looks like this. And when you open up your box, you're going to get a nice little hard case like this. And when you open it, you're going to get this pen. And I must say, it's actually quite pretty. I love the color purple, but it actually has a spot where you could store your needles, store your cartridges, and then your pen. And then the medication for this is kept refrigerated, so until you're ready to use it. So if you're picking it up from your clinic, they will keep it in the fridge, and they will probably tell you to bring a cooler bag or something to continue the cold chain storage that is required. Taking your pen out of your box, remove the cap. It's an empty pen, okay? So you need to remember that. If you're getting your prescriptions through the pharmacy, you need to have this pen in order to administer the medications. Your cartridges are going to come like this. So you want to make sure that you have the pen to administer the medication, because the medication is in the cartridge and you obviously need the pen in order to do the shots. So what you're going to do, this part of your pen, you're going to just unscrew it slightly and it comes off. You remove it. This part right here, you're going to gently on the gray bring it out. This is the spring. I never know what to call this part, but this gray part that I'm turning is going to bring this black part out. This is what's going to apply pressure in the cartridge so that when you dial your dose and push the injector button, it's going to push the medication into you. So you want to bring this out all the way until it stops, and so it has stopped. So it's quite a bit. And then what you're going to do is just take this part of your pen, okay, it's empty. Grab your cartridge that you got, probably from out of the fridge. The cartridges, your clinic will tell you, they come in like 12 micrograms, 36 micrograms, 72 micrograms, multi-dose, depending on what your doctor is prescribing. This metal part going in first, okay? See the gray rubber stopper here? That's what this pushes against when you're dialing your dose and injecting your dose to have the medication come out. So what's going to happen is you need to put your pen together. So here you push that, and then you'll see there's like a lock and an unlock. So right now we're on the unlock because I've just attached the two pieces together. We need to lock it. So we're going to do that, and you may have heard it'll click. Listen. Now it's locked, okay? What you need to do when you have a new cartridge is prime your pen. Or prime the cartridge before you're doing your shots. So when you get your cartridge and you've loaded it into your pen, your cartridges will also come with the needles that you need to do the injections. What you're going to do is take an alcohol swab, clean the top. Just like that, okay? We're gonna prime the pen first. So when you look at your pen, it's gonna have these two little droplets here. You're going to go to the second droplet, which looks like a full droplet. So you've got like the outline of a droplet, which is empty, and then you're going to go to the full droplet. So I'm just going to do that by turning this part away, and it goes to the full droplet, if you can see that. Now what I'm going to do is take my new needle every time, peel the seal off. This will screw on until you get resistance, okay? And then what you're going to do is remove the large cap, remove the small cap, and then you want to prime your pen. So small needle, this is your injector button. So what you're going to do is just gently push this, and you're going to push it in an upward motion, just like that. And then you may have seen that where it dripped a little bit, and there's a little droplet there. That's priming your pen, so removing the air from the tip of the pen to the needle. Okay? Now, once you've done that, you're going to dial your dose. So, dialing your dose, you're going to take it. So, if your dose, it's based on your BMI, so the doctor will have it specifically for you. When you're picking up your medication, the nurse, if they're dispensing it to you, or the pharmacist will give you exactly what you need. But keep in mind, it is a multi-dose cartridge, so you're going to get more than one injection, hopefully, out of it. So if your dose is 12 micrograms a day and you get a 12 microgram cartridge, it's going to last you one shot. Whereas if you're doing 6 micrograms a day and you get a 12 microgram cartridge, or 36, we'll say 36 microgram cartridge, that's going to last you 6 injections. Okay. The thing with Rekovelle is that the dose right now, they're saying that it does not need to be changed. So what you're going to do is the dose will stay consistently from the start all the way to, say, day 10 or day 12, as long as you're doing these injections. So we're going to start with a light dose because I'm going to poke myself, and this is a demonstration, so it's saline in here. So I'm going to dial the dose, and if you hear, it clicks every time. So when you're looking at this, you've got a line every time, and then it shows you it's got the 1, it's got the 2. So if my dose is, I'm going to say 2 micrograms because I'm poking myself and this is saline. But if you're doing 12 micrograms, you're going to go all the way to 12. If, say, I overdial and I go a little bit more than my dose, which I'm saying is 2 micrograms, what you're going to do is push this here, and that actually brings it back to you to the line before. So it'll bring you before. So you're going to apply this. If you've overdialed too much, you're pushing this back end of the pen. And what you're going to do then is just continue to dial until you're at your correct dose. So I said mine was 2. There it is at the 2. I'm not quite sure if you can see that clearly. But now I'm going to do the injection. So small needle, subcutaneous injection going into the tummy, preferably, or the thigh, whatever is easiest. Some clinics will only say tummy, some clinics will say tummy or thigh, so entirely up to you. Same technique. So if you find that you need something to cool the area, to kind of numb it first, you can use a cool compress. Wrap it in something, your ice pack, so it's not directly on the skin. You don't want to damage the skin. Maybe about 10 minutes if you have 10 minutes. Sometimes people just want to kind of do the shot and get it over with. So if you're one of those, you can just go ahead and do the shot. Take your alcohol swab, and what I'm going to do is just lift up here, and you're going to see that's my belly. I've got lots of fat. I'm going to clean the area with alcohol. Now I'm going off to the side, so my belly button is here, 2 to 3 fingers away from the belly button. I've cleaned this area here. I've got a good inch to pinch. So what I'm going to do is just go straight in. Okay, so that's me all the way in. I'm going to let go, and I'm going to press this injector button here. So not this one, but this one. And as I'm injecting it, it's going to slide, and it's going to go in very nicely, very quickly. Once you can't press anymore, you want to count maybe for about 5-10 seconds because I'm talking, so I'm just kind of going through it. So say we've got 5 seconds left. 1, 2, 3, 4, 5. Then I'm going to just gently pull out. I'm not having any bleeding. If you are, you can just press with an alcohol swab, and then for a few minutes that'll stop. And then what you're going to do is just fix yourself up. We need to remove this needle. So what we're going to do is large cap, and I'm just going to put it on a flat surface here. I'm going to just tilt this downward so you can see what I'm doing. This here is just going to go as such, and then what I'm going to do is unscrew the needle. that comes off. This goes into your medical waste bag. Your pen cartridge remains in because it's a multi-dose pen or multi-dose cartridge. Recap, and then you're just going to put it back into this beautiful case. Got it backwards, just like that. If you've got extra cartridges, you can put them in here, just like that. Your needles, you can put there, okay? You'll also find that when you pick up your pen, you have this, your little booklet. It tells you how to use your pen, work your pen. If you can't, for some reason, access the video online, it just gives you all the information about the pen. So you've got your little booklets like that, one in English, one in French. This, store it as per your clinic instructions. So if it's refrigerated, do remember to keep it in the fridge. If you've left it out for quite some time, do check with your clinic to see if you can still use it or if you need to get a new cartridge, okay? The pen itself can be used for multiple cycles as long as you haven't broken it or dropped it and cracked it or whatever. It's the cartridges loading into the pen that need to be changed when you're running out. So anytime you're looking at your pen and say you've done it for a few days and you think, I don't know if I need another cartridge, bring it into the clinic, let the nurse look at it. She'll be able to tell you if you need a new cartridge or a new cartridge to get you through, say, a weekend or the next couple of days until you're going back to the clinic. Okay? I hope you found this very helpful. Please feel free to email me at yourivfnurse@gmail.com. You can follow me on Instagram at yourivfnurse. And you can subscribe to my YouTube channel or comment down below. Thanks for watching.